Hi, Miss Mason. My name's Nicole. I'm the nurse practitioner working with Dr. So-and-so today. How you doing?
Good.
Okay. Do you have any questions or concerns before we get started?
Nope.
Okay. Go ahead and prop your foot up here. All right, so today we're going to be doing your comprehensive diabetic foot exam. First, I'm going to start with a visual inspection. I'm going to check your skin. I'm looking for any edema in your calf, your ankle, and your foot, and I don't see any. Have you noticed any lately?
No.
Okay. I'm also looking for any discoloration, any distended veins that would indicate that you have poor circulation, and again, I don't see any, which is a good sign. No bony deformities or abnormalities that I see. Also looking for any calluses, ulcers, or blisters. Nope. I see just a little bit of callus here and here, but that's okay because those are protective. I don't want you to take those off. Leave those there. It's also really important to check between the toes, looking for any dry skin, cracking, even skin breakdown there. A lot of people forget about that area. And I'm also looking at your nails. I'm looking for any ingrown toenails or extra thickness that would indicate a fungal infection or repeated trauma to the toenail. Okay, so what I just did there, I want you to be able to do that daily. It's very, very important for diabetics to check their feet daily. I think we're in a good spot right now, but I want you to check it either every night before you go to bed or every day when you get home from work, when you take your shoes off and you're rubbing your feet. Go ahead and look at them then. It'd be the easiest time. Okay? And if you have trouble looking at the bottom, you can use a mirror, but make sure you look at the soles of your feet because, problems can start there as well. You may be asking yourself why, and I want to emphasize that diabetics are at an increased risk for developing ulcers and other sores, and it's really hard for you to detect early on. So you'd be better off visualizing it. You also have, are at an increased risk, you may not yet, but you might develop poor circulation, so your wounds may heal a little bit slower, so we want to catch them early on. Okay? You have any questions so far?
No.
Okay. I also kind of want to check for your circulation. That means checking your pulses. You have one back here. It's called your posterior tibial, which is good, and your dorsalis pedis, and they're both +2, which is normal. I'm also checking for warmth. Your feet are a little cold, but it's really cold in here, so that's okay. Next, I want to check your sensation. Okay. Now, I'm going to be using a little tool called a monofilament. Okay, and I'll give you one before you leave. And it comes with a little packet that gives self-instructions. But anyway, I want you to close your eyes and tell me when you feel me touch you with this, okay? It's not sharp, it's not going to hurt you, but just say yes, okay?
Okay. Yes. 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 Yes.
You said yes a lot. Okay, you felt it in all 6 of the areas that I felt, which is good. That's normal. Now, I want you to do that when you're doing your nightly foot inspections or daily foot inspections. And this little sheet gives you the areas that you check. Here you go. And if you notice any decrease in sensation, I want you to immediately call and come in, okay?
Okay.
All right. Next, I'm going to use a tuning fork. Since I don't actually have one, I'm going to be using a salad fork. But I'm going to strike this, and this tests your vibratory sensation. So when you stop feeling it, let me know, okay? Close your eyes.
Okay.
Okay. And tell me when you stop feeling.
Stop.
Okay. I check it on my wrist, and I no longer feel the vibration either. So your vibratory sense is normal. It's good. Okay. The reason I do this is I want to check you for any kind of neuropathy. That's decreased sensation from damaged nerves that diabetics can sometimes get, and that makes it really hard for you to detect a problem until it's too late. Any pain in your feet, you may just not notice. Okay. Last, I'm going to check your musculoskeletal strength. I want you to push down your foot against my hand. Very good. And pull back. Okay. And I didn't notice any problem in your gait or balance as you were walking in. Have you noticed any problems with that?
No.
Okay, good. All right. So, like I said, it is super, super important for you to inspect your feet daily. Okay, and just do the visual inspection like I did. Checking in between the toes and looking at the bottom of your feet. I want you to moisturize your feet daily, not in between the toes, just on the top and bottom, but you can use some moisturizer with lanolin cream in it or lanolin oil. That's really good for your feet. Also, I want you to avoid going barefoot altogether. Indoors or outdoors, it doesn't matter. I want you to wear shoes at all times because you may stub your foot or step on something and either not know it or cause a wound, and it takes you forever to heal. Okay? I want you to wash your feet daily with warm, not hot water and mild soap, and I want you to make sure you dry it off really good. Now, when you're washing your feet or even when you're getting to the bath or the shower, I want you to test the water temperature with your elbow or your wrist, not your feet, okay? Because you could very easily burn your feet and not know it until later. As far as shoes go, I want you to wear really well-fitting shoes. Now, what that means is fit, everywhere else, but I want you to leave room for your toes to wiggle. That way your toes aren't squished up. And I know you have all these pretty high heels that squish your toes together. That causes friction and can cause breakdown in between your toes, so be really careful with that. I guess last thing is when you cut your toenails, again, I know it's not the most ideal, but I want you to cut them straight across, okay? That decreases your risk for ingrown nails, and I want you to make sure you don't leave any sharp edges because those could cut the toe next to it. Okay? Do you have any questions about that? I'll give you a handout before you leave so that I know that was a lot of information I threw at you all at once. Anyway, everything here looks good. I consider you in the low-risk category, so we'll just continue to have these comprehensive foot exams annually. You'll come in, for your other appointments, but we won't necessarily check your feet. Unless, of course, you run into a problem when you're doing your daily foot checks. If you see an ulcer or breakdown or any kind of wound at all, don't try to treat it yourself. I want you to give us a call and come in so we can look at it, okay?
Okay.
All right. See you later.
Thank you.